Fears of a second wave of COVID-19 infections have emerged in Beijing after dozens of residents have tested positive. But reactions were swift as Beijing is conducting rapid mass testing and upgrading of epidemic control and prevention measures. And the Chinese CDC's chief epidemiologist has revealed that the Beijing COVID-19 flare-up is a different strain of the virus than has been circulating in the rest of China. So, what new risks are people facing now? What measures are needed to minimize dangers? And what progress is being made towards a viable vaccine? To talk about these issues and more, I'm joined by Cui Huiyao, our CGTN correspondent in Beijing, Dr. Huacheng Zhu, Associate Professor from the State Key Laboratory of Emerging Infectious Diseases at the University of Hong Kong, and Dr. Chen Xi, Associate Professor of Health Policy and Economics at the Yale School of Public Health, and Xiao Hong, CGTN correspondent in Seoul. That is our topic. This is Dialogue. I'm Zhou Yue. So, Huiyao, let me start with you. We thought we were in the clear, but we were not. The Beijing Health Commission said on Monday Beijing recorded 36 confirmed new cases of COVID-19 and 6 new asymptomatic cases. Tell us more about the latest in Beijing.
Sure, Zhou, the stakes are definitely very high. Now, with 79 confirmed new cases reported in just 4 days, and 8 districts have seen new infections so far, you know that this latest outbreak has definitely sounded alarms. And almost all of these cases are linked to one single market, that is the wholesale meat and vegetable market, Xinfadi, which is located in the southwestern section of the capital. Now, authorities are testing as many people as they can, especially those who have come in close contact with the market. On Sunday, they tested over 76,500 people. 59 of them showed positive results. And just hours ago, local authorities say they have reached nearly 200,000 people who have been to Xinfadi market and are going to test them in the coming days. And I don't know about you, but on my phone, I've received numerous text messages from the officials asking people who have been to the market to come forward to report their case and to get tested. So Beijing has 98 testing sites, and they have the screening capacity to test 90,000 people a day. And that's from the local health officials who say that this is going to be enough to meet the demands.
But how worried should we be? But the risk levels in Beijing have already been raised from low to medium. What exactly does that mean, and what will Beijing do?
Well, like you said, Beijing has been taking very swift steps to contain this new outbreak, including shutting down the major market, closing off 11 different communities and several schools in the area, and really ramping up tests in key areas, like I mentioned, in Fengtai district and Xicheng district. Meanwhile, an epidemiological investigation is underway to trace the origin of this virus, and so far experts found that the virus strain that caused this latest outbreak was related to that in Europe, but no further information was provided. And Wu Zunyo, another expert from the Chinese CDC, said earlier that the initial finding shows the virus was brought into Beijing from elsewhere. But that was all he said. Now, at this point, it remains unclear how this virus was spreading and whether it was transmitted through food or asymptomatic people. So further investigation is still underway.
And also, the institution that Wu Zunyo served, the Chinese Center for Disease Control, said that Beijing is going through an important test in the fight against COVID-19. If not handled well, it could be a second wave. So what kind of risks we are looking at in Beijing?
Exactly. Well, the capital city has not seen new locally transmitted cases for nearly 2 months. And now the latest development has triggered a number of concerns among people. The biggest concern is whether this outbreak would develop into another massive and deadly outbreak like what we saw in Wuhan. Experts have expressed different opinions, with some listing a number of key differences from the Wuhan outbreak. For instance, China has gained a lot of experience fighting COVID-19 since January. And secondly, Beijing as the capital just has more resources and more capability in handling a crisis as huge as this one. Now, having said that, the risks are there. The wholesale market supplies over 80% of the city's fruits and vegetables, and that means daily trade and transactions were pretty vibrant in the lead up to this outbreak. Now, on average, we know that 15,000 people go in and out of this market per day. And that is why we have seen cases popping up across the city, which has spreading in 8 districts already. So how many people have come in close contact with these people? If you do the math, the risk of this virus spreading further and causing more infections should definitely be taken seriously.
But as you said, we are 6 months into this disease, and 50 days we haven't seen any single cases. But you've been to the market. How would you describe the nerves of the local people?
For sure. I think on the very first day that Beijing had more cases, I was there on Saturday, and me and my cameraman, we couldn't get close to the market because obviously it was shut down, and there was heavy security presence there, a lot of armed police, a lot of public security cars. Every 10 meters you see a police car parking there, and the stakes were very high. You could tell immediately as you get up close to the market. And we parked on the street as we saw a couple of fruit vendors. They, with their trucks, they're selling their stuff, they're unloading their fruits, peach, apricots, and I stopped by and asked them. They said they were notified the night before that the market was no longer accessible, and they had to sell their stuff on the street. And they know they're going to make losses for sure, probably a lot of losses, but they said they understand the government's taking measures because life and health always come first, and probably they are going to be, or they have already been tested by authorities at this moment.
Well, it is indeed a new test for the people in Beijing. Thank you, Huiyao. Shane, I know that South Korea also saw some new cluster cases. How did the South Koreans handle the outbreaks?
Well, it's an ongoing attempt right now to try and stay ahead of the curve, so to speak. If you look at how South Korea has tackled this COVID-19 virus, it's been a combination of aggressive testing and contact tracing, and it helped that South Korea did have a head start, in fact a 5-year head start in dealing with the MERS virus that gave health experts here the oversight and really the tools to do this aggressive contact tracing. Here we saw in the initial stages facilities designated to treat patients with milder symptoms so as not to overwhelm hospitals and the health system here. By doing so, the country was never locked down. Economic activity and free movement were allowed. We saw a big cluster really form in the southeastern part of the country, but now what we've been seeing the past couple of weeks, ever since late April when we saw the number of daily new cases in the single digits, we've seen that climb after a long weekend in early May when there was a big cluster of infections at a nightclub here in Seoul. And since then, we've seen the daily number of new cases in the double digits. Today we're in the 30s, and we've seen that for the past couple of weeks now, and that doesn't seem to be changing, and that's what officials are trying to do, is try to stay ahead of the curve. But what's alarming is that the number of untraceable cases seems to be increasing, and that's what authorities are really afraid of and concerned about, especially with restrictions loosened here. Schools have resumed classes. Students are going back to school here, and it's really hard to reel back any of these guidelines that have been loosened already.
And Dr. Zhu, as of Monday, Beijing's new cluster cases stood at 79, all of which are linked to market, as our reporter just said. What do you make of the outbreak in Beijing? Because as our reporter just mentioned, it has been 50 days that we haven't seen domestic cases here in China.
Okay, so the reemergence of the COVID-19 cluster in Beijing, especially after the 0 local cases for around these 2 months, actually this event indicates that in spite of our very strict disease control measures, there's still some gaps in our knowledge and some blind spots in our preventive strategies. For example, the possibility of contaminated food or goods transported from other disease-affected regions, is it possible? And also the possibility of some undetected asymptomatic patients who is traveling to the community, and also the possibility some infected animal host previously unidentified. probably get a second chance to expose itself to the human beings. We don't know. We have no clue about this. So, but fortunately, so far in Beijing, most of these cases, they are all linked to the Xinfadi market, and the contact tracing and also screening has already been conducted very promptly. So within just these few days, thousands of people has already been detected, and the environmental has also been screened. So I think that with our previous experience and our successful control experience, I believe that we should be able to bring this to an end very soon, because now we know how to have the more transparent communication, the public education, and people, they also realize that how to protect themselves, how to maintain a good personal hygiene, and also even if there's an outbreak, how could we have the early detection, early intervention, and also the early control measures to stop this disease from further spreading.
And Dr. Zhu, about the origin of the virus in the market, because the Beijing clustered cases of it was studied, and it says the virus strain is actually from Europe. So there are theories how the virus get into the market. One is through contaminated seafood and meat imported from abroad. The other is through human contact. But considering the fact that China has restricted international travel, is it likely that it's more probably because of imported food carrying the virus from Europe?
Yes, I think that because we are living in the global village, and with the Europe and also American are now suffering quite a lot from the COVID-19 disaster. So I think it is actually not that surprising to me to see such kind of a European-like virus, and it probably indicate the imported source of this virus to Beijing. But so far, because I have no chance to have a look at the full length of this genome, and I cannot tell whether it's really directly brought in from Europe, or it could be possible that there is multiple possible source, and Europe just serving as one of the possibility. But fortunately, today I just checked the GSET data set, and I found out actually there have been over 47,000 genomic sequences for the COVID-19, the SARS-2 virus. So if we got the sequence from Xinfadi patients, we can just simply run a blood search and figure out what might be the most possible and most similar virus related to this new virus in Beijing.
And another thing that worries a lot of people is it erupted at a food market, because it reminded people of the Huanan seafood market in Wuhan in January. But obviously, people have learned a lot more about the virus, and also the response alertness is different. How would you say this market outbreak is different from that one in January?
Okay, so I would say that previously our focus is more on the human-to-human transmission. But after this Xinfadi outbreak, and also some previous reports from I think from the US, from Korea, and even from Hong Kong, the cold chain transmission and the possible contamination of food and goods could be quite possible. So I think that with the new events happening in Beijing, especially when there's no epidemiological link directly indicating the human-to-human transmission at the very beginning, we cannot ignore the cold chain transmission, and we need to be more careful about the food security, and I think avoid ingestion of some uncooked or some contaminated food. That's something we need to consider. For those occupational exposed workers, they also need to maintain the good practice and the good hygiene, try not to contaminate the food or get themselves exposed to the food from outside.
But so far, all the new cases found in Beijing found their origin in the in the food market in Xinfadi. So that's a good thing for epidemic control, right?
Yes, yes, sure. So we need to make sure that there's no more cases spreading further. Yes, that is at the very critical stage and also the goal window for us to control and avert this new outbreak.
And what is your assessment of the level of the Beijing authorities? They tested nearly 79,000 people in a single day and found roughly 50 infected. And they will probably go on with this kind of testing. Is that enough?
I think that is very impressive. I think that with these several months, we have already got enough, very sufficient experience. We have enough facilities, personnel, well-trained personnel, and also reagent, everything stocked there. So we are well prepared. We know how to precisely trace those possible person with the risk, and also we know that what kind of environmental factors or things we have to focus on. And I think that just a few weeks ago, we finished the mass surveillance in Wuhan. That also gave us a lot of nice experience how to handle this kind of very prompt screening in a very huge scale.
All right. And Shame, I know that the South Koreans have become very familiar with this cluster cases, as you said, sometimes in a single day, 30 or something new cases. Do they still feel worried, or they are quite accepting the new normal?
Absolutely. The concern is there. I think it's a matter of not if, but when this second wave of infections will occur. And interestingly enough, a government-sponsored study or model was released today, and it showed that unless stricter social distancing guidelines are introduced, that daily number of infections could increase to up to 800 by as early as next month. And if you look at this model, what it measured was the reproduction rate of this virus by looking at two things: the probability of infection and the number of contacts. Probability meaning what is the prevention or the probability of this spreading can be prevented by wearing masks, and then the contact needs to be reduced through social distancing. If you walk around South Korea, masks are readily worn here, so it's a matter of how to socially distance. And for policymakers here, they have to consider possibly really enacting these stricter social distancing measures more stricter than ever. And the question is whether South Koreans will have the patience to accept the return to social distancing, because these clusters have formed not just in one place, but they've occurred in a variety of places like warehouse distribution centers, places of worship, singing rooms, and ping pong clubs. So it really does run the gamut. But what we do know is that many of these, or the majority of these cases, are happening in the Seoul metropolitan area, where, of course, the population density is highest in the country.
So is it safe to say that South Koreans don't have a timetable to really get rid of the social distancing rules anytime soon?
Well, I think one prominent scientist once told me that nobody's well until everybody's well. And really, it doesn't matter how well one country does in tackling this COVID-19 crisis, because, of course, you have so much movement in this day and age between people. So the concern is there. And again, what health authorities here are trying to do is trying to stay ahead of the curve. And to do that, it's prevention, and just basic sanitation, washing hands, keeping your distance at work. So a lot of this is voluntary at this point, and what everyone is afraid of is that measures may need to be taken so that work from home measures are become mandatory as opposed to voluntary, and that's something that South Koreans don't want to go back to. And really, any successes that the country may have had would be deemed not if it does return to that point.
We have Mr. Chen on the line. Professor Chen Xi, what is your take on the comparison of the types of viral gene sequencing from different countries to determine whether the virus detected in Beijing is imported from elsewhere? Does that make a difference in terms of epidemic control?
Yeah, I think this is an effective strategy because so far all the cases are coming from the single market. So that means we are in the early stage of transmission, if there is. So, but we do not know whether this is from overseas shipping of the food or is initially started from someone from, for example, Europe, who were coming into the market and infecting others through their droplets and others, some other things. So it's effective to use this gene sequencing strategy to say whether where this may come from. So at the beginning of an outbreak.
And balancing epidemic control and economic recovery is probably a big challenge for every government because the Chinese seems to come to realize that well, we are in the clear already since we haven't seen cases for many days, but all of a sudden there is an outbreak in Beijing. So how should people look at a second wave and what should they be doing to get ready?
Yeah, that's a great question. As I mentioned, there's very little signal about a large-scale transmission outbreak ongoing. So it's more restricted to the local market. So and in the time period before any vaccine and antiviral drugs, it's very important to maintain the testing and especially the testing capacity because we do not know where the sporadic outbreak may come in the next coming months. So we have to, all the societies in the world has to wrap up the testing in order to face any upcoming challenge. But we do have no idea about where the exact or the specific location of the outbreak. So that's the essential step to reopen the economy because the testing and the testing capacity and the tracing will give the real-time data for any public policy making to deal with the outbreak.
And we also collected some opinions and advice from international social media users on the outbreak here in Beijing. Let's take a look at what some of them have been saying. Obviously, the Beijing case has raised alerts from around the world. R.A. Smith said, I fully understand China's fears, but to put this in some context, the total case count in Beijing is 10% of the daily case count for Arizona. And China's freaking out. Everything that maybe even the most alarmist of us here might not be worried enough. So let's put that into perspective, Dr. Chen. We have seen 80 cases in roughly 5 days here in China. And already people in Beijing are very worried about a second outbreak. But in the United States, daily cases still in tens of thousands. Should we look at the count in that way? And how different is it when different societies are looking at the numbers of new cases?
Yeah, for example, you were mentioning about Arizona, but in the U.S. it's very different because there's no national strategy of testing, so which is really worrisome. But if we establish such a strategy to testing people and wrapping up the test, then we are able to flatten the curve and make sure it is not surpassing the capacity of the healthcare sector. So we can look at the China's neighbor, which is South Korea, was doing. South Korea had 37 new cases yesterday, and in the event of Beijing, is very similar to the size of new cases in South Korea. But South Korea has been able to maintaining the open of the economy without panic because they have their confidence of testing strategy. And the case number shows that the U.S. used 100 days to surpass the South Korea in terms of per capita testing. So that was the time when the virus was transmitting in the local communities. But so that was a very hard lesson China could learn from the U.S. So we should do the testing and ramp up the testing early and prepare for the PPE for the local health facilities. As long as those things are prepared, I don't think there should be a panic from the public or from the healthcare sector.
And Shane, is testing the number one thing we should learn from South Korea experience? And what does it mean for policymakers when they are seeing cluster cases on a single day?
Yeah, indeed,
hard to
this
say
is.
that one system or
Let
one
Shane
way.
first answer that question. Shane is our reporter in Seoul. Please, Shane.
Well, I think not every system is made for every single country, but I can say that South Korea used, again, a combination of aggressive testing and contact tracing, and these tools were put in place 5 years ago, giving the legislative tools to give health officials the power to really survey any patient that's confirmed with the virus, including cell phone records, CCTV footage, to really try and stay ahead and prevent any sort of contact. The initial challenges for South Korea came when a big cluster formed in a religious group, a religious sect down in the southeast, and then at a nightclub where people weren't readily wanting to come out and get tested. And so what the government did was they allowed for free testing anonymously because really the public health and safety came at a much more of a priority than possibly personal information.
What are those technologies you've been using, Shane, in terms of contact tracing and keeping people in isolation if they found to be infected?
Well, the alerts that South Koreans receive on a daily basis are probably anywhere from a couple to dozens a day, and really authorities use that technology to get the word out. So personal liberties are sacrificed.
Okay.
If you are a confirmed patient on a website, that information is all posted publicly for the public to really digest.
And Dr. Chen, many people say that probably we have to face the new reality. That is, we must coexist with the virus for a long time for any nation in the world, be it China, be it South Korea, be it the United States. What do you think? And what does it mean for average person and decision makers?
Yeah, I think this is the new reality, as you mentioned, before any vaccine or antiviral drugs. So this pandemic may last very long because it's already in almost all countries, all continents, and all seasons. And we also need to reopen the economy. With the new economic activity, there's always a rising of these cases. This is definitely the germ theory that when economic activity goes up, the virus spreading goes up. But the scientific evidence and evidence-based policy making to flexibly adjust for this changes in the transmission will be very important. So it may be a long term because this is a change in people's feeling of uncertainty. Without a drug to be helpful and vaccine to be protective, so people may still have the uncertainty to return to normalcy. And so that would be taking a long time.
We have 1 minute left, Dr. Chen. You mentioned vaccines. Will the continuation of clusters somewhere in the world change the vaccine development strategy in any way?
So there are basically so far the old-fashioned and new-fashioned way to develop the vaccine, but they are all ongoing. Some use the whole virus to make the vaccine. Some use the genetic material to make. But we have used the time to tell which one is more effective. And none of these vaccines are in the phase 3, which may occur early in the next months. And I think what's really challenging is how to implement it to a larger cohort of people with so many clinical trials ongoing. So they are competing for the volunteers.
Okay.
And finally, if there's anything available, how to ramp up and to accelerate the production for most of the people in the world.
We're running out of time. Thank you very much, Dr. Chen, and thank you, Shane, for your insights. You've been watching Dialogue here on CGTN. I'm Joe in Beijing. Thanks so much for watching. Goodbye.